Good afternoon, everyone. So thank you for joining me today. I am Twinkle, a final year trainee clinical psychologist, here to talk about my research, and I'd also like to give my thanks to Anna Tickle, who is a co-author of the paper. So we're here today to talk about an important issue that affects people experiencing homelessness and substance use, but the area often remains misunderstood. So we're here to look at the intersection of homelessness, hostels, and substance use, because homelessness isn't just about lacking shelter, it's also about vulnerability, facing inequalities and systemic barriers. And understanding this complex relationship is key to shaping more compassionate and effective responses moving forward. So there's just a screenshot of the actual paper itself, but the published paper will be circulated and the slides after the webinar. In terms of some context, so homelessness is a significant and growing issue in England, and it's often linked to the austerity measures that began in 2009. And the Homelessness Reduction Act provides a legal definition of homelessness, which includes not only people without any form of housing, but also those whose accommodation is unsuitable. And this could be because it's unaffordable, overcrowded, unsafe, or temporary, like hostels, which is what we'll be focusing on today. We know that from recent data from the 2022 estimates, around 227,000 people in England are facing homelessness, which is a rise from the figures in 2018. Now, the scale of homelessness is often underestimated because that figure is unlikely to capture those who are sleeping rough or are sofa surfing, but we know from figures from 2020 and 2021 that 67% of people who are assessed as homeless are at risk, or are single adults, and mostly men, followed by single parents with children, and then couples both with and without children. And we know from research that homelessness is rarely a single experience. Many will go through lots of cycles of street sleeping, staying in hostels, emergency accommodations, and sofa surfing. And on average, people face about 3.5 different forms of homelessness each year. So just based on those figures itself, it's unsurprising then that experiencing all of those different forms of homelessness and the instability that comes with it takes a toll on people's well-being. So poor mental health and poor physical health can both lead to and result from homelessness. And it's not surprising then that substance use is more common among people who experience homelessness than people who are housed. Understandably, it means that almost half of individuals experiencing homelessness report using drugs or alcohol as a way to cope with their situation. And this could be things to manage past trauma or the stress of losing that stable housing they might have had in the past. But it's important to recognise that, not everyone facing homelessness uses substances, and the pattern of substance use can also vary. But that being said, the intersection of homelessness and substance use, it does present with additional challenges. So people in this situation are more likely to face higher risks of drug-related activities, deaths, infections, and chronic health conditions. And we know that the stigmatization and fragmented communication between services can often lead to a mistrust in services, and then that can exacerbate problems in terms of accessing health and social care. And we know that these people will also encounter more barriers to healthcare. They might often prioritise their basic needs, things like security and shelter, over their healthcare needs, which is something that we'll talk a fair bit about today. In terms of some context about hostel accommodations and the barriers that people face, hostels remain the main form of accommodation for single adults experiencing homelessness, but we know that the quality of hostels can vary greatly. There's not a set definition of what really constitutes a hostel, and services will differ based on local authority resources, but we know that they can be run by commissioned organisations, private providers, or third sector groups, so each one will have different rules and regulations. But for the purpose of the discussion today and the review, hostels are defined as short-term, temporary accommodation, usually for up to 2 years, and they typically involve shared facilities like bathrooms and kitchens. So the Homelessness Reduction Act aimed to address homelessness by placing duties on local authorities to intervene at earlier stages. Now, while the Act was well-intentioned, it doesn't really fully account for the complex needs of those who use substances. So for those facing both homelessness and substance use, access to stable housing can be life-changing. It's really, really important. But sometimes those strict hostel rules often exclude those who are using substances, and then that pushes them further into a cycle of instability. So many hostels have strict no substance policies, meaning people who use drugs or alcohol can then be excluded from accommodation, and that then leaves them more vulnerable and less likely to engage with services in the future. And what that does is it creates a cycle where people remain stuck in homelessness. People will then use substances to cope with that lack of stability and support. Then they will access support, but then they're excluded from hostels for using substances, and then they use substances to cope with how difficult it is. So they're just stuck in that cycle, and that makes it really difficult for them to proceed to recovery. So that's a bit about accessing hostels, but living in hostel environments are also challenging. Often hostels can have rules such as curfews, visitor restrictions, and that really limits access on certain areas, and it undermines residents' sense of autonomy. Now, while these rules are intended to maintain safety, they can sometimes feel punitive and counterproductive. And we know that from research, people who use substances and experience homelessness will face those additional barriers like unaffordable housing, long waiting lists, prior evictions, and judgmental staff. But we know that a strong support network, whether that's through friends, peers, or compassionate staff, can then really help to navigate these challenges and maintain some sense of stability for them to then work towards recovery. So in terms of the importance of the research, there's growing recognition of the importance of creating supportive environments in hostels. So two key approaches that we'll touch on today are psychologically informed environments and trauma-informed approaches. So psychologically informed environments involves designing services to meet the psychological needs of both residents and staff, while trauma-informed approaches will focus more on improving the staff awareness of trauma and its impact on individuals without then re-traumatizing individuals. So we'll talk more about that in the next few slides. But both approaches can improve the experiences of people living in hostels, and it makes it easier for them to engage with support services. So as we spoke a little bit, the compassionate, non-judgmental relationships that residents might have with staff can make a really big difference, because when people feel understood and supported, they're then more likely to engage with treatment and other services. But unfortunately, what we do know from existing research is that staff working in hostels often face competing demands and have very limited resources. And although the intention is there, it makes it very difficult for them to build meaningful relationships with residents. It's also worth noting that much of the existing research at the moment before this review is done on homelessness and substance use comes from the United States and Canada, where hostels will operate under different regulations and patterns of drug use will vary. So what that did was highlight the need for UK-specific research and tailored approaches. So we hoped that through this review, we would have a better understanding of how people experience hostels in the UK, and that can then help us to inform policies and practices. But ultimately, it's about improving outcomes for people experiencing homelessness and substance use, and that requires a much more integrated approach. So it's not just about improving access to healthcare, but it's also ensuring that housing services are designed with the specific needs of substance users in mind. So we know that the Advisory Council of the Misuse of Drugs, they recommend involving people with lived experience in designing services to ensure that they're fit for purpose, which is what this study then aims to focus on. And by synthesizing the existing research and really listening to the voices of those who are directly affected, we can then create more effective, more compassionate services that breaks the cycle of homelessness and substance use while people are in hostels. In terms of the review aims, so we will consider how do people who use substances experience accessing and living in homeless hostels, and do hostels support or hinder behavioural change? So in the interest of time, I won't go into lots and lots of detail about the methods today, but it is explained in detail in the full paper if you are interested in knowing more. But for some context to help you understand the results that we'll go on to in a few slides' time. So when selecting studies for the review, we focused on a clear criteria to ensure the findings were relevant. So we included studies for participants over the age of 18 with current or past experience of substance use, whether that was alcohol or illicit substances, while accessing or living in homeless hostels. And we only looked at peer-reviewed research or doctoral level studies using qualitative methods, and all of the studies had to be written in English and conducted in the UK. And to maintain quality and relevance, we excluded studies if they focused on hotel accommodation, like the Everyone In scheme during COVID-19, because that doesn't really reflect the usual experience of this population. And we also excluded studies where qualitative data couldn't be extracted. And this approach really just ensured that we worked with robust, insightful experience to truly understand the experiences of this group. So to conduct the review, we followed a really structured and thorough approach. Again, the details are in the paper, but just for some context, we looked at 7 electronic bibliographic databases to really search for relevant studies. They were all assessed for whichever studies were relevant, and then to analyse the results, we looked at an interpretive meta-ethnography for data synthesis. And basically what that is that it looks beyond just summarising the findings of the literature that already exists, but it looks at forming a new qualitative interpretation. So we looked at what participants might have said in those studies, what the authors might have said about the participants, and then what we think as reviewers. I know that might sound a little bit complicated, but we'll go through each theme one by one in a few slides' time. So in terms of study characteristics, in total 8 reports are included in the systematic review, 7 journal articles and 1 doctoral thesis. All of the studies were published between 2008 and 2021, and it looks at a participant count of 143. Now, in the studies that we looked at, there was a notable gender difference with 106 males and just 37 females. So that's just important to hold in mind when we consider the results, that it does focus more on male experiences than female experiences. The age varied across the studies, with reported mean ages ranging from 37 to 45 years old, while 2 studies noted age ranges between 21 and 55. The recruitment method differed, but all the studies relied on interviews for qualitative data collection, and the analysis of the data was used using thematic analysis and framework analysis. So in terms of results, 4 themes were developed. So we've got living in fear, the power of human connection, the need for emotional safety, and the use of restrictive practices, which focuses on 2 sub-themes: rules taking away choices and infantilization. So we'll go through each theme one by one in more detail, but we found that many studies had similar themes across the studies, but there were also some contradictory accounts within different people within each of the studies and between different studies. So these themes, supported by direct participant quotes in the next few slides, it really captures the complexity of navigating hostel life alongside substance use. So the first theme is living in fear. So across 4 studies, participants described a constant state of fear, particularly concerning their physical safety. So this included concerns about being stolen from by their other residents, including money, food, and drugs. And sleep being a fundamental human need, it was often viewed as feeling risky because many residents felt constantly on edge when they were in the hostel environment. So in some cases, there were direct threats made to people's personal safety, such as incidents when I remember a resident made violent threats, even while being intoxicated. So one participant recalled a really frightening moment when another participant kicked their door and shouted, "I'm going to kill all your family." And these aren't just isolated incidents, but they're part of a larger pattern of anxiety that many residents will experience. But it's not just those overt threats that residents face, there were also some of these indirect dangers. So one common concern was the stealing of food, which then made a significant impact on participants' physical health. Now, what these findings suggest is that the most basic needs of things like safety, food, and sleep are often unmet in hostels. And as a result, individuals living in these conditions, they don't really have the resources or stability that's needed then to then be able to focus on their recovery. But I guess it's also important to acknowledge that not everyone in here shared the same experience. So some participants actually expressed gratitude for the basic necessities that they received in hostels, even if the physical conditions were quite poor. So in one report, a participant compared the hostel to heaven due to the security and the resources that it provided. And for other residents, particularly those who were struggling more with substance use, described hostels where it felt like a safer environment to use drugs without the dangers of being out in public, where time and space pressures are much more intense. Now, we can assume that this provided them with a sense of control and it allowed individuals to relax while using drugs. So we can see from the quote on the right-hand side, the top one, where one individual shared, "If you're outside or homeless, you are more manic. It's more dangerous. You miss the vein and you're paranoid. You're vulnerable. You are open. In hostels, you can relax because you know nothing is going to happen to you." And I guess that raises a really important question that, could hostels be inadvertently perpetuating drug use by providing an environment that feels safe for users? Now, while some individuals felt safer in a hostel, others expressed a preference for sleeping on the streets rather than being in a hostel because of the dangers that the hostel presented with. So one participant expressed, again in that speech bubble on the bottom, "I'd actually rather sleep on the streets than stay in a hostel. That's scary, isn't it?" And what that does is it shows a really stark reality that some people feel that hostels, rather than providing a safer alternative, are even more dangerous than public spaces. So I guess it's important to consider, what does that mean for those living in hostels? So while hostels may offer a sense of safety or respite for some people, it may also then increase their drug use if they're feeling more safe to use drugs within that environment. But for most individuals, they experience a high level of threat and vulnerability, which can then hinder their recovery process. And it's really crucial that we address these issues to ensure that hostels provide not only just shelter, but also a safe, supportive environment that encourages recovery and growth. So the second theme is the power of human connection. So participants in studies frequently emphasize the importance of belonging to a community. So many spoke about the deep need for meaningful friendships, especially with people who understood their struggles and were in a similar situation. And these friendships were more about companionship, and they were built on things like daily interactions, sharing experiences, offering mutual support. And it was really clear from all of the 8 studies that actually loneliness was often accompanied by their living conditions. And this was a really significant factor affecting many residents. And these connections, these emotional connections, were essential for their survival. Now, in the context of hostels, where material possessions are often limited, residents would sometimes share what little resources that they did have, and that included drugs. So for some, sharing drugs became a way for them to bond. It became a way for them to find common ground and feel accepted within the community of a hostel. But then what this also did was create a dangerous cycle that individuals who had never used drugs before found themselves encouraged into substance use in order to fit in with the other people at the hostel or connect with other people. So one resident described how sharing drugs was a way to increase common interests, but for many it led to those deeper struggles with addiction that followed afterwards. And for others, the need for connection manifested in a different way, so that was through alcohol use. So one participant shared how they turned to drinking as a coping mechanism to manage difficult emotions and their low self-esteem, despite being aware of the harm that it was doing to their physical and emotional health. So what that really does is it highlights the idea that when people are isolated and they have fewer resources to rely on, they may then turn to substances as a way of coping with loneliness and as a means to feel a part of something, even if that connection is then temporary. We can see from that quote on the right-hand side, one resident shared, "You haven't got enough money for a drink, but I have. You need drink, you need drugs. You know what I mean? It's a big circle." They could all sit around the table quite merrily 24 hours a day. And what that does is it illustrates how the cycle of substance use can become really intertwined with people's social needs and survival, especially in environments where people really crave that sense of belonging. But we know from the research that I looked at is that not all residents shared the same view around connections. So some really expressed a desire to avoid friendships with people who were using drugs because it felt like it tempted them to turn to behaviours like drinking, using drugs, or doing crime. And these individuals felt that such connections brought them more stress rather than support into their lives. Whereas other residents prioritised other types of relationships like romantic relationships and seeked connection and intimacy as a way to feel loved and accepted. But what it does is, I guess, this conversation really invites us to reflect on the power of human connection in shaping many residents' experiences and behaviours, especially in an environment that might foster the isolation. We know that, the need for community and belonging is undeniable. It's a fundamental part of who we are as human beings. But when that connection is built around substances, it creates that paradox that the very thing that's bringing people together and increasing that sense of belonging can also then lead to significant harm. And ultimately, I guess what this theme shows us is that it's so complex and layered, that the need of connection in these environments, but it's not just about friendship or forming romantic relationships. It's more about that survival, the coping, and underlying all of that, just trying to feel human in a very, very difficult circumstance. So the third theme is the need for emotional safety, particularly in residents' relationships with hostel staff. So across 4 studies, residents consistently highlighted the importance of feeling emotionally safe in their interactions with staff. So when staff might have appeared unprofessional or uninterested, it had a significant impact on the residents' sense of self-worth. Residents then felt like they weren't a priority, and as a result, they felt unheard and unsupported. And that lack of emotional connection then created a barrier to trust, both in the staff but also within themselves. And we know that without this foundational trust, it then becomes much harder for residents to engage in their recovery and build meaningful relationships with other people. I know that sounds all negative, but actually there were some positive experiences too. So some reports really stress the importance of staff creating a psychologically informed environment. So a space where, residents felt heard, respected, valued. So one participant shared that simply being treated like a human and having staff listen to their concerns made a really big difference. And those actions were vital in helping that resident to rebuild trust, not only in other people, but also in themselves. And as I mentioned, that trust becomes that foundation for opening up to other people, seeking support from services, and approaching recovery with a more optimistic outlook. That being said, we know that the road to emotional safety isn't always straightforward. So two reports pointed to significant barriers that hostel staff face, such as large caseloads and organisational pressures, which made it really difficult for the staff to build these kind of trusting one-to-one relationships that residents needed. So we can see from that quote in that speech bubble where one resident said, the staff I don't think they didn't care, I just don't think they had the time to give the individual care that people needed. And the only time you ever got spoken to was if you were in a crisis. If you wanted to talk. If you wanted to talk to your key worker, you pretty much had to cut yourself up. And it's really clear, I think, from that quote itself, that hostel staff are doing their best under challenging circumstances with the limited time and resources that they have in order to try and provide that level of care and attention that residents truly need. I think what it does is it highlights a really critical issue that when staff are really stretched thin and they're unable to offer individual care, it then directly impacts the emotional safety of the residents. And that's not an issue about the staff not caring. In fact, far from it. It's more about those systemic challenges that hinder staff from offering the kind of support that they want to give. But ultimately, emotional safety is fundamental to recovery, and that's what this theme really highlights, that when individuals feel heard, respected, and treated as humans, they're then far more likely to build the trust that they need in order to be able to move forward with their recovery journey. And this insight encourages us to think about how can we create environments where emotional safety is prioritised, where staff can truly connect with residents, and residents can then begin to rebuild the trust needed that's necessary for their recovery. So the fourth theme is the use of restrictive practices, particularly around how rules can take away choices from residents. So this theme explores the delicate balance between rules and hostels and the emotional safety of residents, all while acknowledging the very real struggles that hostel staff will face. So across several studies, participants shared that their experience with hostel rules, many of which made them feel like they had very little control over their lives. So residents often spoke about living in constant fear of being evicted, even when they were unwell, which then already adds to that significant pressure of their situation. Now, we understand that hostel staff are often working within a framework of rules and regulations set by commissioners, and these rules can sometimes feel quite rigid for residents. But it's clear that some hostels did show more flexibility within the reports that we looked at. So, for example, one manager took a resident back in because they were unwell, even though technically they should have moved out. And that gesture of compassion then allowed the resident to feel cared for and gave them the support that they needed to be able to get back on track. But where the challenges sort of arose was when residents felt that certain rules, especially those that limited their personal autonomy, were being imposed in a way that felt impersonal. So for instance, things like mandatory room checks were done without prior notice or consent, and that left people feeling really violated. And similarly, the no visitor policy, which is meant to maintain safety, can also sometimes leave people feeling isolated, especially when the reasons behind the policy aren't explained. So as one resident expressed, again in the speech bubble on the right, one resident sort of said, I'm a 34-year-old man. I should be allowed to have visitors whenever and however I want, and as many as I want, like anyone else in the house. I should have power over my own space. I mean, I'm an adult. People leave hostels because of that. And what that does is that really underscores just how important it is for people to feel like they have a control over their own lives, especially because a lot of the time, people who experience homelessness and substance use, they will have not had a sense of power over situations in the past. They will have come from really traumatic backgrounds where they wouldn't have had that sense of control. So by taking away their sense of power in situations like this, it then unintentionally re-traumatizes individuals. And I guess what I'm trying to emphasize is that it's not the rules themselves that are inherently negative. In fact, many residents actually understood the purpose of certain regulations, like the no intoxication policy, in terms of not being able to sort of drink within buildings. And people understood that that was a way to keep things safe and calm within the building. But what made a difference was the way in which the rules were implemented. Because when rules were communicated with respect and compassion, and when residents really understood the reasoning behind the policies and they had this space to ask questions or voice their concerns, they then felt more included and less alienated in the process. And that allowed them to maintain their sense of autonomy, which is really essential to then rebuild that trust and move forward in their recovery. So we know that things like compassionate communication and understanding, where residents feel heard and respected, can then create a space where rules are seen as part of a safe and supportive environment rather than a restrictive barrier. Because in the end, it's just about fostering that trust in small increments. So when people feel that staff are genuinely care about their well-being and they're willing to take the time to be able to explain and understand the reasoning of the rules, it helps them to create that more collaborative environment. And then that leads to better outcomes for everyone, residents and staff alike. And the final sub-theme is infantilization. More so in terms of how that impacts residents' sense of autonomy and self-worth. So while we'll focus today on the challenges faced by the residents, as that's what the research looks into, I think it is also crucial to acknowledge the difficult role that hostel staff play in trying to balance safety, structure, and support for the individuals. So in 4 of the studies, participants expressed frustration with a perceived lack of autonomy in hostels. So many described being treated like a child, which then led to feelings of powerlessness. So one resident said, again in that speech bubble on the right, "I'm too independent to be in a hostel, prefer to do my own cooking and everything, and just not have people, staff, try and treat you like a kid, because they've got the authority to stand there and tell you what to do." Now that perspective is not uncommon among residents who really crave that sense of independence and control over their own lives. And this comes with the acknowledgement that, hostel staff are often working under immense pressure, managing multiple residents with varying needs and trying to maintain a safe and structured environment. So we know that rules and routines are put in place to protect both the residents and the staff, but they can sometimes unintentionally undermine a resident's sense of agency. Because when people are deprived of basic choices, such as things like cooking their own meals or making decisions about their daily routines, it can exacerbate that feeling of frustration and hopelessness, which is already deeply ingrained in their experience of homelessness, probably in the past. And that lack of autonomy then diminishes their self-worth and hinders their recovery. So residents who feel like they've got no control in their lives are then more likely to feel helpless and disconnected, which then makes that road to recovery even more difficult for them. That being said, as I mentioned, we know that hostel staff are dedicated to helping residents, but the challenge often lies in how to balance safety and structure with the need for autonomy and respect. So residents really need to feel trusted and capable, even in an environment where rules are necessary for safety. And that can be done through empowering people with small choices, such as deciding when to cook, who to invite into their spaces, or how to structure their day. And that can go a really long way in helping them to regain a sense of control and dignity. And of course, we understand that's not always easy, but where possible, allowing residents to have a say in their daily lives, even in small ways, can have such a profound effect on their well-being and their journey in recovery. So it's about ultimately striking that balance. Rules and structures are essential, but that opportunity for autonomy, when done thoughtfully and with compassion, can be a vital part for restoring dignity and empowering individuals to take control over their recovery. So to summarize the results, so the synthesis of all 8 reports show that for many, living in hostels meant having unmet basic needs and living in constant fear, both of which significantly then hinder people's recovery. Some residents reported that the fear of threats in hostels was so intense that they felt safer sleeping on the streets, while some found hostels provided a safer environment to use drugs, but this then unfortunately perpetuated those cycles of drug use. We know from the research that drug use often became a way to connect with people, as the need for belonging and community was the strongest in these types of shared experiences. And we know that staff do want to create emotionally safe environments, but the pressure of things like high workloads and rigid rules can often undermine residents' autonomy, connection, and their sense of control. And this combination of factors then creates an environment where behavioural change is really difficult, further than hindering the recovery process. And I think from this research, it was really clear that conditions in hostels would need to evolve to better support recovery and emotional well-being of residents. So some discussion points into hostel environments and challenges to recovery. So recovery can be really difficult when basic needs like safety, security, and stable housing aren't being met. And this review really highlighted how many hostel residents face exactly that living in environments where they didn't feel safe, it meant that their basic human needs of security was their priority, rather than being able to focus on their healthcare needs, such as substance use. And from a psychology perspective, when people feel unsafe, they often enter this heightened state of anxiety. They're more hypervigilant. So then they focus on survival instincts, right? So that makes sense when we consider the link between trauma and homelessness, which has a strong link. Many residents are already carrying the heavy weight of trauma from their past experiences, and hostile environments can sometimes add to that, not intentionally, but because of those direct threats and frequent feelings of unsafety. In that state of survival, it's not surprising then that residents are more likely to engage in behaviours like substance use as a way to cope. So then they are just sort of stuck in that cycle. And what we know is that recovery requires stability, both physical and emotional. But when housing itself can feel unsafe, progress can become incredibly challenging for them. So while hostels can provide shelter, what this review suggests is that the conditions often felt short when creating that physical and emotional safety that's needed for recovery. And it also highlighted a lack of trauma-informed practices by the hostels that we looked at within this review. So really having approaches that prioritize understanding, safety, emotional well-being. And ultimately, it shows us something that's really important, that recovery isn't just about access to services, but it's about creating environments where people start to feel safe, regain a sense of control, build that foundation that they need in order to be able to move forward. Because without that safety, that cycle of survival that I keep referring back to, it just continues, and that makes long-term change much harder to achieve. So in terms of the need for trauma-informed care, one of the biggest challenges that hostels face is balancing safety with autonomy. So as I mentioned, rules are often necessary in order to maintain order and protect residents, but when these rules are enforced without explanation or flexibility, that's when hostels can start to feel more like places of a discipline than support for residents. And that can then undermine residents' sense of control, autonomy, and connection with others, things that are already very fragile with someone who's experiencing homelessness. But what these findings show is that when policies are clearly explained and residents are given a sense of choice in their care, then acceptance of the rules increases, and that makes life easier. So it's not just about having rules, but it's more about how they're being implemented. And this aligns with the principles of psychologically informed environments, which focus on understanding the emotional and psychological needs of residents. Because when rules are applied with empathy and awareness, they're then more likely to be seen as supportive rather than restrictive. Now, this approach doesn't just improve the hostel experience, it also supports recovery. Research consistently shows that when people experiencing homelessness are given choice and control, they then perceive treatment for substance use in particular as being more effective. So it's really about empowering individuals rather than imposing solutions on them. And that further reinforces the importance of trauma-informed approaches, which prioritize principles like choice, control, and autonomy. And that aligns with the guidance from initiatives like the Changing Futures programme, which encourages services to be more flexible and responsive to individual needs and then adopt trauma-informed approaches. So ultimately, while rules will always have a place in hostels, the focus should be on how they're developed and how they're implemented. So really considering things like, are they introduced with compassion? Do they allow for individual needs and circumstances? I think more detailed research in the future could shed light on how to strike this balance more effectively. But what is clear is that when people feel respected and empowered, they're far more likely then to engage with support, not just with hostels, but external services, and move towards recovery. So in terms of design of hostels, when thinking about how to make hostels safer, one response could be improving current system, but another and perhaps a more powerful response is to rethink the model of housing for people experiencing homelessness and substance use. So the congregate model, where residents have private rooms but share communal spaces, it might seem practical and cost effective, and it even has some of those social benefits like fostering connection and belonging for some people. But the reality is that for many people, it actually works against recovery. Living alongside other people who are using substances and feeling physically and emotionally unsafe because of the threats that they're experiencing isn't helpful for recovery. It's like asking someone to recover while being surrounded by the very triggers that they're trying to escape. And that approach sometimes creates that false economy. So what seems to be cost effective on paper can then lead to greater long-term costs for both individual and society in the future. So what the evidence suggests is a more cost-effective approach. So, providing unconditional shelter with basic amenities alongside access to both medical and psychological support. But crucially, that needs to happen in an environment where residents can really avoid substances and other people using this, because without that, recovery becomes this uphill battle. And another significant challenge is to create emotional safety for residents is the strain of the workforce. We know that staff often face intense pressures from commissioners, things like high staff turnover rate, staff shortages, burnout, and it's really easy to see then that when staff are facing such immense pressures, that can then lead to environments that feel more punitive and authoritative rather than supportive. Because understandably, when staff are feeling overwhelmed, the focus can then unintentionally shift from compassion to control in order to be able to manage the situation. And residents then often experience that restrictive practice that can then feel infantilizing, like we spoke about earlier. And I guess sadly, it doesn't just hinder recovery then, it can also then push individuals further into substance use as a way of coping with the emotional distress created by such environments. So ultimately, if we truly want hostels to be a place of recovery, I guess we need to sort of rethink the approaches to hostels. And that means creating spaces that promote safety, autonomy, and support, not just shelter. So shifting from those short-term solutions to long-term, more sustainable changes that genuinely then help people to rebuild their lives. So in terms of future recommendations, it's worth noting that only 2 studies within the review actually involve service users in designing the research. And that's really significant to note because since those studies were conducted, there's been clear recommendation for service providers to include the voices of people with lived experiences when designing and delivering services. And that kind of involvement could then lead to services that really better understand residents' needs for safety, connection, and autonomy and move away from restrictive practices. It's also crucial to consider the inclusion in terms of that reflecting diversity, so considering factors like gender-specific needs and other individual experiences. So as far as we know, and to our knowledge, this review is the first to truly focus on the voice of people experiencing homelessness in the context of hostels, substance use and behaviour change. And the message was really clear that that physical and emotional safety is absolutely essential for recovery. Without it, hostels can risk becoming places that perpetuate the very challenges that they're aiming to resolve. So to move forward, services need to think carefully about how they promote recovery while housing people collectively. So that includes tailoring psychologically informed environments and really adopting trauma-informed approaches. And that's more than sort of that relational safety between residents and staff and also between residents, but also reconsidering rules. As I mentioned, it's not just about how the rules are, but also how they're introduced and implemented. Because done right, that can then really create environments that feel safe, supportive and inclusive, spaces where people can find belonging without substance use being central to that collection. So encouragingly, there is evidence that services can become more psychologically informed, even with limited resources. So Sophie Buckley and Anna Tickle did some research. There'll be references at the end of these lectures, at the end of the slides, but that shows that there are sort of possible ways in order for services to become more psychologically informed, even with those limited resources. But for consistent safety and support, wider systemic change would need to happen, particularly in terms of commissioning services that really prioritise things like staff support and retention. So looking ahead, future research could explore the cost effectiveness of investing in recovery focused services, and that might include investment in hostels, but it could also be rethinking hostel provisions altogether. So, for example, a more widespread implementation of housing first approaches where people are provided with stable housing alongside tailored support. And ultimately, the path forward requires collaboration between service users, providers, and policymakers, because it's ultimately about creating environments where recovery is supported. Because, from all of these slides, everyone deserves the chance to rebuild their life in a place where that they can truly call home, somewhere where they feel safe, dignified, somewhere where they feel empowered. Thank you for listening. I'm happy to take any questions, comments, or reflections. And my email address is there in case anyone wants more details or access to the paper.